My name is Jonna Bach, and I am with the MAT Medication Assisted Treatment Program at Buncombe County Detention Facility through Sunrise. Medication assisted treatment is medication that binds to your opioid receptors but is able to provide for you a very stable life when you are taking it. It helps with cravings a lot. It helps with things like sleep. It helps with anxiety. People who stay on MAT for a few years have a very, very good chance at never returning to use for the opiates. And upon their release, they are able to get 5 days worth of medication, which we are able to, within that 5 days, get them a bridge prescription to make them to their next doctor's appointment before we get them into a clinic, which we often try and get them into very low barrier clinics that are very close by and have them enrolled in Medicaid, so their appointment is very cheap and their medication is very cheap. We also provide transportation to the appointment if they need that. During their incarceration, the folks that identify as having opiate use disorder, the people on our MAT program, we provide group classes for them. I do 2 a week. They're both on women's units where I sit with them for an hour, and we do. I personally do MARA meetings, which is Medication Assisted Recovery Anonymous. I also attend something called Power Hour, which is once a week for an hour, where anybody that is a peer support specialist is able to come down onto the units and just spend time with the participants and talk about recovery, talk about how you got to where you're at. And I've had a lot of very powerful interactions that way. Yeah, upon their release from the facility, they call us, and we go from there in getting all of their needs met. We are able to provide for them transportation to and from appointments, things like doctor's appointments, court, probation. I took someone to look at a camper they wanted to purchase. We're able to provide really solid peer support for them. Essentially, if they want my help, I can give them almost everything that they need to start over, even if they don't have money. So I have written down about 25 success stories in my year and a half at the facility. And one of my favorite ones, his initials are JD. And it was somebody who identified as having opiate use disorder, had spent, most of his 45 years of life in and out of jail and in addiction. And at this point had finally decided to do something differently. When he got out, he called me, and we were able to get him into a sober living. We were able to fund it for quite some time for him. He was able to make it into drug court, which is a super successful program. A lot of my successful participants are in drug treatment court. We were able to get him a phone, get him Medicaid, get him rides, get him clothing, food. I have helped Jeremy with everything I possibly could have. And he is actually on his way to becoming a peer support.